Welcome, everyone. We're so excited to see you all. There's some other folks coming into the waiting room as we speak, but I'm going to have Lynn Duran give us a welcome and introduction to today's event.
Yes, good afternoon and welcome. It's so nice to see so many of you here this afternoon. My name is Lynn Duran and I'm the Assistant Dean for the Office of Student Affairs at the College of Public Health. Thank you so much for joining the MPH Applied Practice Conference Student Highlight. It's a mouthful. And I always have to look down at my script to remember remember the whole thing. We're so excited to have you all here with us today, including your current students, faculty, preceptors, and hopefully some prospective students as well. We would like to take a moment to respectfully acknowledge that the University of Arizona is on the land and territories of Indigenous peoples. Today, Arizona is home to 22 federally recognized tribes, with Tucson being home to the Atam and the Yaqui. Committed to diversity and inclusion, the university strives to build sustainable relationships with sovereign Native nations and Indigenous communities through education offerings, partnerships, and community service. As you may know, our Master of Public Health students from each of our campuses conduct applied practice experiences in communities around the world. The applied practice experience serves as an integral part of the MPH degree curriculum, in which our students utilize their academic knowledge from the classroom and real-world practical situations among professionals in the public health workforce. We are so profoundly grateful for the collaborations between our students, faculty, and agency preceptors, and are very proud of the contributions our MPH students have made to the field of public health. This virtual applied practice experience conference is our opportunity to showcase the breadth and depth of public health work that our MPH students have done with local, national, and global communities. Coming up next, you'll hear from some of our MPH presenters and learn more about their amazing experiences. After our student panel, we will provide some additional details about the conference and how to view our fantastic student presentations. Thank you. I'll give it back to Kim.
Thank you. And again, welcome all. I'm seeing a great turnout of students, faculty, staff, which we love to see. Thank you again to our panel. We're very excited to learn from you today. Excuse me, I'm just getting over a cold, so bear with me just a little bit. My name is Kim Barnes, the Director of Student Affairs for the Phoenix campus, and we're so happy to have our panelists with us today. We have Precious, Erin, Grace, and Kendra. These amazing MPH students represent various concentrations across our Tucson and online campuses. We are so excited to learn more from you all today, and so we're actually going to jump right in, and I'm going to ask each of you to briefly introduce yourself and your applied practice experience, like where it was, what you did, 1 to 2 minutes each, and share a little bit. And we'll go ahead and start with Precious.
Hi, everyone. Good to be here. Well, my name is Precious, and I completed my APE with the Pima County Health Department. I was in the epidemiology division, particularly under the One Health Office. And within the One Health Office, they look at several things that affect both animals and humans, and how the environment interacts with the two species, not species, but the two entities, the human and animal health bit. So within my APE, I had two goals. The first one was to develop a levy submission algorithm, which was to benefiting more from the background of risk assessment of rabies cases. Just to give a bit of a background, rabies is not a disease. It affects dogs, bats, all mammals, I should just say, like all mammals. So now, in the context of wildlife particularly, there are lots of gray areas where sometimes it becomes a bit difficult about how best to handle the situation if you have a sample, if there is a suspected exposure in humans, for example. So do you just gauge whatever sample and submit it for testing? Do you just kill every other animal that you think is probably a rabbit case. So within that area, we looked at developing an algorithm that would help the two entities that look at that, which is the health department as well as the Pima Animal Care Center, in submitting or in making decisions about what samples should be submitted and how best to communicate if there is a possible exposure in people that interacts at that level. And secondly, I was looking at how when you've been exposed, you then have to get post-exposure prophylaxis, which is basically a vaccine plus antibodies after you've been beaten for you to prevent development of a full-grown disease. So within that, sometimes there are times when cases that are low risk end up getting post-exposure prophylaxis. There is nothing wrong with that, but there is an economic component of that where it sometimes becomes a burden on the patients that are presenting with such kind of cases. So we looked at how much costs or what costs are associated with that with those kind of cases, and also try to identify possible clinics or centers that could be probably targeted for potential correlation or education, or at least just a chat about best practices in trying to avoid sometimes unnecessary costs on the patients. So in brief, that was what I was looking at. And I'm happy to be here and chat with you all about how that experience went. Thank you.
Thank you, Precious. Grace, will you share with us next?
Yes, hi everyone. I'm Grace Atkinson, and I'm a health behavior health promotion major here at UA as an online student. So I am excited to bring that different perspective here. So for my AP concentration, I worked with the West Virginia Prevention Research Center. So my preceptor is Dr. Christensen, who's here with us today, and my supervisor is Dr. Tracy Jarrett. So I'm very grateful for their mentorship throughout. So the West Virginia Prevention Research itself provides world-class public health research and evaluation services all throughout West Virginia. So for my specific APE, I worked with the West Virginia Health Equity Action Team. So West Virginia HEAT, just as a kind of overview, is a collaborative and cross-sector group of volunteers across West Virginia that all come together to address the challenges faced by racial and ethnic minorities, along with LGBTQ plus individuals throughout West Virginia. So since I'd say about 2020, HEAT has worked to provide a bunch of resources such as fundings and trainings and data to community-based organizations and public health practitioners with an overall goal of just advancing health equity all throughout West Virginia and beyond if they could. So I'm very grateful to have some of our partners here with us today. And so for my APA itself, since HEAT's been changed, the landscape of HEAT has changed drastically even throughout the last year with all of the different things going on in our world. I originally started with the notion of, create a grant and really kind of the goal of sustaining HEAT, because I've been working with the PRC since my undergraduate years. So it was really of how do I take a different learning aspect from my career and apply that into my master's program. So I was thinking about grant writing since that's a huge part of the PRC itself, and how can I apply the skills that my coworkers have and apply that into my career and my learning experience itself. So I originally started out my AP with the goal of creating a grant that would help sustain HEAT for the next, year to 5 years. And we were going to work with the Robert Wood Johnson Foundation. But because of the cease and desist that got put in place in the spring, we had to majorly pivot the deliverables, and we shifted instead to a communications aspect, because personally, I love creative aspects and communications. And I thought that was another way to kind of sustain HEAT's mission over the next 5 years was my goal. So with that, I thought first I could do a membership survey that was put out to all members of HEAT, and we did a pilot survey of just gathering together materials throughout HEAT's time of what projects have they done and where can they go with that work and with the current members and their capabilities, because we did have a lot of members that weren't able to operate during working hours, which really limited their time to be able to work with the group and the outreach of the group itself. So my first deliverable was the membership survey that we pilot tested with the members, and we're still working with the members on seeing how we can kind of change the concept of HEAT, not the concept and the overall goal, but more so, how do we engage with the community? Are we more so doing trainings, or are we going to, pivot more towards virtual settings of more general member meetings? So that's been a great goal of ours, is to just kind of see where our members are at today with the capacity of their workload. And so then my second deliverable kind of fed into that, how do we expand the membership and reach of Heat itself? So I thought we already had communication set up in place by some of our Heat members. So I set up a website itself. Soon we'll be launching westvirginiaheat.com. So I'm very excited. So I worked the last, I'd say, 4 to 5 months on just gathering all of the materials, getting feedback from our members, all of that fun stuff, to get all of those website things in place. And it's just been so fun to kind of apply all of the branding that was already set in place in our social medias throughout Facebook and LinkedIn and all of that, and apply it to one central location. So hopefully in the future, members can be able to go into that. So we were grateful enough to be able to get a grant for 1 year from the Sisters of St. Joseph Foundation in West Virginia to sustain our website funding for at least 1 year. And then we're hoping throughout that year, we can find some further funding to keep that going. So that's my APA in a wrap. Thank you so much.
Thank you, Grace. Erin, can we hear from you about your APE?
Yes, of course. Like Precious here, or I'll start off by introducing myself. My name is Aaron Harris. I am also a Master's of Public Health student. I am concentrated on epidemiology, and my applied practicum experience was also through the Pima County Health Department, similar with Precious. However, I worked in the Community Mental Health and Addiction Division. Um, my internship was more data and analytical. So my two deliverables was to work on creating an analysis on opioid overdose mortalities in Pima County. This kind of followed with the division's emphasis on bringing awareness to critical issues surrounding mental health, which included suicide prevention and drug overdose epidemic. So I was able to work with the overdose mortality data that they collected over the past 4 years. Um, I had more data than just those 4 years, but in order to adjust for that data, I took occupation and industry estimates because we were looking to see what occupations and what industries had more ra higher rates, not just the counts. So there's some industries that are going to have more workers. So looking to adjust for those employment workforces, I took data from the state that provided county estimates for Pima County, and I was able to adjust the mortality counts of overdoses over the industries and occupations. So, I ended up finding that industries such as construction, um, mining, extraction, very laborious work tended to be higher rates. Um, So I was then able, from that first deliverable of working with the data, I then went to my second deliverable, which was working on a policy brief and doing some research into policies around the country that looked at um, workplace guidelines or workplace policies that w would look to aim to prevent overdose, either on site or off site. And so I pretty much found some policies. It's very sparing. Federally, there's not that many policies around enforcing overdose prevention guidelines. So I looked from states, different counties and unions, identifying some that required naloxone or Narcan, which is a drug that helps to counter an overdose or stop someone from overdosing. So there are some policies that had that drug um, to prevent overdose on site. There's also policies that required some industries, high risk industries, to have um, training, overdose, um, being able to detect the symptoms of an overdose, being able to know how to distribute naloxone and prevent an overdose. So I looked at policies after my data, and I kind of made a policy brief that tailored it to Pima County and how we would be able to um, potentially or just make some recommendations to politicians on what can be implemented here in Pima County.
Thank you, Erin. And last but certainly not least, Kendra, can you share a little bit about yourself and your experience?
Of course. Hello, everyone. My name is Kendra Martinez, and I am an MPH student here with a concentration of climate change and health. I had the wonderful experience and fortunate enough to spend my summer in Guatemala. So I partnered with the GHI Global Health Institute here at the University of Arizona Scholars Program to do some water quality research as well as health communications in the Lake Atitlan region. So what that involved was definitely more than my deliverables, but my two deliverables were health communications, trying to communicate the health effects of what is going on in water quality in that region, as well as how do you start to communicate certain issues within water. So beyond just bacteria, thinking about things like heavy metal. As a note, this is a continuation of work that is being done by Dr. Frank von Hippel's team. You may or may not have heard of the breast milk contamination study, but this is a continuation of that. So I had an opportunity to work with the CEA, the Centro de Estudios Atitlan, from the Universidad de Valle de Guatemala, UVG, as the partner. And what we did is we tried to figure out what was the first steps when it came to health communications. And my work specifically was trying to come up with some graphics that might be used for the public use in the future, as well as fotonovela ideas. Fotonovela, for those who are not familiar, is just a way to use storytelling in terms of trying to communicate these health issues or health concerns and how people can prevent it. So additionally, I worked with a lovely colleague, Yuen Ana Soto, who is a PhD student here at the University of Arizona, to do some primary data collection in the town of Panajachel to continue the work that was aforementioned. So this included going into the community, talking with some local mothers, as well as collecting both biological and water samples. Additionally, there's so much to do in the CEA. So I was also part of water analysis, and I do apologize. This might be getting into some of the other questions we'll be talking about later. But to be very brief, I was able to learn some water quality research methods as well. So it is wonderful to be here. Thank you all for coming out. And that is a little bit about my APE.
Thank you all so much. So I have had the privilege to watch each of their presentations. I invite you all to do the same. We'll have more information at the end of our panel on how you can access their presentations. But one thing that I noticed as I was watching them is that obviously we have different concentrations represented, right? Health behavior, climate change, One Health, and EPI. Yet everyone had a communication component to their APE, which I think makes sense, right? Communication is central to most industries and certainly to public health. But I found it very interesting that even if a project was very quantitative focused, there was a communication piece. And I really like, I mean, that's the core of public health, right? Is that there's central tying competencies and central tying themes. But it was really great to see all four of you have such a strong focus on communication in in at least one of your deliverables in those pieces. So we do have in the room, and it's always a good question for us to ask, we have prospective students and current students who may be looking for internships or APEs. How did you find your APE? How were you able to find and secure that experience? And anybody can start, or I can call on someone. Okay, we'll start with Grace.
So I was actually lucky and fortunate enough to have already worked where I did my APE. Alfgeir might be able to talk more about the internship process itself for securing, since he knows more of that. And since I just kind of jumped into the position, all I did was ask, what's a project that's different from my work that I currently do? and, still is in line with my career goals and my academic goals, but still supports, the mission of the PRC in any way possible. Alkir, I don't know if you wanted to chime in at all of the preceptor end of things with hiring someone that's also working and doing an internship.
Well, thank you. Not really, but I'm happy to have the floor here. This was pretty simple and easy. When you have great students, there's not a lot you need to do. I was merely a timekeeper and a cheerleader, and that's really what you are in with great students. So, congrats to you and all.
Thank you. We love that perspective. That's a great one. You know what, Grace? I think it sounds simple, but we do have a lot of students who are working at the place that they want to secure an internship, and they're not sure how to do that. And so to hear from you that it can be simple and that you are looking for something different than what you do for work is really the cornerstone there. So thank you for sharing that. Kendra, you mentioned you did the GHI Scholars Program. Can you elaborate on that a little bit?
Absolutely. So the GHI Scholars Program happens each year, and it is a very interesting initiative through the University of Arizona to provide students with international research experience. So there are partners around the world. We're talking anywhere from Mexico to Australia to Ireland. So it is definitely an opportunity for students to also have a funded research experience. So how I found out about it was actually before I applied, I was looking at different opportunities because I'm like, I know that I need to do an internship experience. And I saw that this is an opportunity. I was interested in international research. So I was like, once this opens, I'm going to apply for this. So I think that is also something that I always encourage is like, if you see something, even if you're at the early stages of planning, just go for it. Even if it's something. So for example, water quality is not my area of expertise, but I still applied for it. So I guess that would be my advice. It's like, even if you don't think it's like quite an alignment, it might still be a very beneficial experience. But if you do need more information, I do have the GHI website as well. So that's a little bit about GHI.
Yeah, thank you. And that is excellent advice, right? Sometimes the APE is actually built in many ways for you to try something, right? It's not a commitment. It's a short-term way of getting some work experience and professional experience. And I think oftentimes students, especially in the GHI program where there's finite experiences, right? So it's not always going to be a perfect alignment, but they find the experience as a whole in terms of the work and the travel and the abroad has always been an amazing experience for those students. So Precious and Aaron, you both were at Pima County Health Department, but I'm curious to see how you found your experiences and whether or not it was different. Precious, start us off.
Oh, yes, I can go first. So I came to know about the work that I ended up doing through Dr. Brown, Kristen Brookriver Brown. I was taking one of her classes, and there was a time she put up an email about this opportunity at Pima County, and I did send my CV, and she forwarded that to Pima County, to the director of the One Health office in AP department, AP division rather, and later on we had a chat. I mean, be honest, there was a bit of time. I thought that maybe I wasn't going to get it, but eventually they did come back to me, and we had a chat, talked about the interests that I had. Good enough, I've been working on Rebis for some time, and it happened to have been that they were also looking for somebody to work on Rebis. So I was so happy to get on board on that. Yeah. So that's how I landed that opportunity. To an extent, I feel like also it was an opportunity that came in because I had expressed my interest to Dr. Progrima Brown. So I would say, I know not there yet, but I would say sometimes it's very important that when you're in classes, you should be open enough to say, I'm interested in A, B, C, D. That way, you never know, the professor you're talking to or whatever connection that you have might lead you to some opportunity within that field. Yeah.
Thank you. So you're doing our work for us by explaining to students what's important here, Precious. Thank you. Right? It's important to make sure that you are advocating for yourself and making sure folks who are in your sphere know what you're capable of and know what your interests are, because our network is often the best way that we make connections to those additional folks and agencies. So what about you, Aaron? How was your experience, or how did you find it?
Yeah, so one thing that I found very important, even throughout my whole graduate program, was to take time to, follow emails, follow up to opportunities, because, there's plenty of opportunities, but they do go, so um, I did follow the AP Hub, looking for what positions are listed. That's always updated. I applied for the AmeriCorps epidemiology positions at Pima County. Unfortunately, I didn't get a match with any of the opportunities that there were from those from that listing, but I did get reached out afterwards from the internship. I wouldn't say kind of like the people that work and to create internships there. They reached out to me saying that there was um, the CMHA, or the Community Mental Health and Addiction team, were looking for an intern, which I thought was really wonderful because that wasn't even an option when I had applied. And, I have a background, my undergraduate in psychology. So I thought that was kind of very nice. It wasn't paid, but I still thought it was a great opportunity. And I ended up working unpaid, but I ended up also being able to apply for a summer position with the same team, and I was able to continue and have a greater and expanded experience. So I think, don't be afraid to apply for positions that you're interested. And even if you don't get those positions initially, reach out. There are programs that they were willing to make, that people want to have interns, people, programs and com organizations are very keen on having, students who are excited about the work. So, really reach out to places that you are interested in, even if, it doesn't work out at first, just don't keep your head up and keep looking, and something will fall in your lap that I think will be worthwhile.
Thank you. And again, we didn't pay these students to say these things, but yes, he found this opportunity on the hub. We do work to keep that updated. And I really like, I don't like that you didn't get the initial experience you applied for, but I like the connection of the no still became a yes, right? So you applied for something, putting your name out there, putting your resume out there, and it was memorable. And so they were able to connect with you. And so I think that that's a really important piece for students to understand, is that the attempt and the effort sometimes isn't initially received, right? It's not the answer you wanted in initial place, but it still puts you in connection and contact with the right people. And so I think that that's really great. So for each of you, I would love to know if you can describe any either unique experiences of your APE or your favorite experience. So something that you found really like powerful or special about your experience. Precious,
Okay,
you
I can
unmuted.
go first. Yes. Yeah. One exciting opportunity that or experience that I had was to have to collaborate with the White Mountain Apache tribe, not as part of my AP deliverables, but as part of the work that is ongoing with the health department. So the White Mountain Apache tribe holds annual Rocky Mountain Spotted Fever control initiatives. And during such campaigns, they invite several people. Some come from CDC, some collaborators are from the health departments, from the SCDHS, the Pima County, and several other counties. And I got to spend 2 days in White Mountain, and it was quite a beautiful experience to have to work together with the tribal leaders, coordinating the campaign that side. We did sprays, we did education, would give out education materials, would chat with the people about how to control Rocky Mountain spotted fever and all that. And I do say this because most of the times we talk about the importance of collaboration, and I got to see that in real time and experience that. So yeah, I found that to be quite exciting.
That's great. Yeah, it's important to remember, I think, with the APEs is oftentimes your work won't just be on the deliverables, that's the primary focus, but you're working with an organization and you're going to get to see and experience those other things. And the White Mountains are beautiful. So I'm certainly happy you got to experience that, Precious. That's great. Kendra, I saw you nod. Did you have some sort of collegiality there you want to share with us next?
Well, absolutely. So, for reference, the specific research center that we partnered with SEA is water quality for the whole Lake Atitlan region. So in that, they do lake monitoring. So I was able to be out on the lake measuring what is going on. And I think that was a very unique experience, particularly as a public health professional. I would say that it was valuable because really, I would say I was the only public health person in the room. So there was a lot, it's on a team of scientists. I think it was a very interesting experience to kind of see, what do freshwater biologists, microbiologists do? And how can we connect that to public health and the water quality? There were also educational initiatives I was a part of where they were teaching little kids about microscopes and look, the water is alive. So I would say, and that is all outside of my deliverables, right? So I would say it was a very valuable experience for me to have because they also had community engagement, but it was more so on the water and understanding, what is the relationship with the water and the people in these different communities? Because there's a rich, complex history behind that. So I would definitely echo that. You never know what you'll be involved in a good way sometimes when it comes to your AP.
That's fantastic. I know I love to play the game 6 Degrees of Public Health, right? Tell me a job and I can somehow connect it to public health. And that's really what you were doing. There's scientists, but you're saying, yes, but you're sharing this information about health and safety and the environment. And that's the public health component, right? And so to be able to make those connections, and often you might find you're the only public health person in the room. So you get to bring that perspective where it was empty before you. So that's really great to hear. Aaron, do you have a unique or your favorite experience you'd like to share?
I really enjoyed working with the team. There's very multiple discipline. I cannot say the word. Interdisciplinary, multidisciplinary team. We had some case managers. We had mental health coaches, educators, data analysts, epidemiologists. It was very diverse. So, and also, kind of case interviewers or case investigators that was very I was able to just view all these different aspects of um, suicide prevention and overdose prevention and kind of looking at these cases where they happened and how we investigate them and go about finding where in the timeline, things could have been prevented. So seeing that was very, very awesome. My team was very awesome. They're very kind and welcoming and open to sharing and supporting me. And, I also was able to attend one or two outreach events on mental health to table and to also one was to kind of an all-day event where I was able to learn about mental health in schools here in Pima and current programs and network with different individuals in those programs. And I even got to hear experiences from students on kind of mental health stigma and how they have been able to go through different time like hard times and being able to promote mental health and how that helps them learning mental health um, terms and just psychological um, kind of stress prevention and being able to handle stress. So I was able to do quite a bit and I really enjoyed. I think mental health is one aspect of public health that you don't get too much of an experience or there's not too many experiences on that. So I really enjoyed it.
Yeah, it sounds like your favorite thing was just the whole piece of it, right? The collaborative nature of the team and being able to kind of wear different hats and see different things. And I think that's the beauty of doing an internship or an APE at a health department is actually getting to learn a little bit more of all of the ways that they're involved in public health, from the science to the community, and how that's going to be reflected in the work that you do. So that's really great.
Thank you.
Grace, can you share your favorite or unique experience?
Yeah, I'm just going to kind of echo what Erin said about the people. I mean, I have three of our current Heat members on, so I think they can just attest to how much change Heat went through throughout the past year. So I think it was just a learning experience really for myself and everyone in the group of, just how to pivot during public health and challenging times in public health and as the world landscape changes so much. So I'd say my favorite part of it was just all the people that I got to meet because I think with my job that I do, it's everybody's online. So I think that it's just kind of a unique experience to get to connect via, the computer screen, but still get to build those relationships because I've been working now with Heat since my undergraduate years. I actually did an internship during my undergraduate years with them as well. So I think it's been so unique to see just the change that the groups gone through over the past 3 to 4 years is really, really something unique that not a lot of people get to see. So that's my perspective there, favorite part.
Yeah, I think when you're working with an organization that has equity in its name, this year's been an interesting one for sure. So I know definitely the pivot component for you, Grace, with the whole start to finish, right? I'm sure. And it's great to hear again the people. And I think a lot of us who have public health backgrounds or in our setting understand and rely on the fact that the people is what makes the work so powerful. And I think that that's great to hear that reflected in several of your comments here. So I would like to know, this is a little bit more of an academic question, but I think it's really helpful, particularly for students and the faculty in the room as well. If you could share a little bit about what knowledge from your MPH program you really felt like you brought into the experience, and then what the experience strengthened for you in terms of knowledge. Like where was that kind of bi-directional of a question, but if anyone wants to comment on that.
Just to repeat, you're kind of saying how what we brought from our classes into the position. Oh man, yeah, that's they just hammering on us the whole program on, making sure we are working with the data in the right way to, so it's not biased, so we're not making stuff up. We're doing it as scientifically, as we can, being able to strategize and communicate how we did things, how we found the results, and what those results mean were very important. So, it was kind of tough with my data because it was count data. In my program, we work a lot with maybe rates, kind of like we work from a population. So in this case, I was missing that population aspect. I only had the numbers of how many overdose cases there were. So I really had to kind of go back and look at my biostatistic classes, like what can I do here? What tools do I need? So I was able to, I won't go into any specifics, but I was able to use like a Boson regression, which worked with count data. I was able to identify data that worked with the surveillance data and put them together. And I was able to clean that because, data, you just think of numbers, but like really sometimes it's just Excel sheets and it's like all messy. You got to like clean everything out. So that's also something I learned in my class with Kristen Pugaba Brown, Dr. Pugaba Brown. Her class is very helpful in teaching us those practical kind of skills. And then with, my epic classes, obviously being able to identify uh, rates the right way, making sure it's the right statistic, stuff like that, and being able to make visuals and make sure that the data I found, I can explain to other people pretty, in a basic way or understandable way.
That's great. Yeah, I know. I think you say the word regression, and anybody I feel like who's taken a biostats class, even though mine was a million years ago, I still like have that moment of like, right. So I think it's really great to hear that you were able to sort of tie in that content. Does anybody else want to comment on this question? Content you feel like you really brought from your classes, Grace?
I'd say for me, communications was probably the biggest part. And I think with, the health behavior, health promotion aspect, it all comes down to who you're talking to, who's your audience. So it was kind of I got given Google folders of all this information for the website. So it was really sifting through all the projects and the whole collection of what has Heat done, in their entirety and what's important to the website itself. So it was really just the communications aspect of really honing in on who is our audience and what is our purpose of Heat. I think in every meeting, we're always reminded of it always just comes down to the communities that we're serving throughout West Virginia. So I think that was a huge part that you can take kind of out of the classroom is just, what is the mission that your career is oriented around and the work that you're doing oriented around, and then how are you supporting and sustaining that as well. So that was kind of the biggest takeaway from the classroom that you could apply outside of the classroom from my experience.
That's great. Thank you. Yeah, I mean, I would hope that communication is a central piece in that concentration, right? We know it is. So that's great to hear. Precious.
Yes, so just like Ellen, I think uh, the big part that came with me was the biostatistical bet into the FE experience, because I had to do quite a bit of data analytics. But at the same time, we've also covered quite a lot about how best practices about handling data and approaching data with Dr. Progreba Brown. And that came in handy as well. And further to that, I think there have been lots of talks about how important it is to collaborate across disciplines and teams from from classes that have been covered with Dr. Progreba Brown as well. And that came in handy because I was working between PAC and the Pima County Health Department. And most importantly, I think having a supportive team. So I was working with Kathleen Norris and Dr. Aaron Santos, and these were very great individuals that guided me through all these, like navigating all these, the hurdles of having to connect sometimes. It's not as easy because when you're working with another entity, it's not straightforward sometimes. And they were very great at helping to navigate such kind of hurdles during that time.
That's great. Thank you. Kendra, did you want to comment?
Absolutely. So I will just kind of echo some of what Grace said when it came to communications, particularly risk communication methods, I think is a very important part of my APE, as the water quality situation within the area is something that is going to take years to kind of communicate to the general public because investigations are ongoing. I would say additionally, when it comes to thinking about my concentration specifically, I think that climate change is a good framework to kind of look at what is going on situationally, not only understanding it from talking to the people there, but also looking nationally and figuring out some of the issues that were mentioned. For example, were kind of related to some of the backgrounds that I have. And I can see, oh, this could be an exacerbator of this, for example. And I think it can also help in thinking about future research or investigations that could be done. So I would say that's kind of when I was thinking about my coursework, I would say it was a good foundation to kind of think of it in a way of how can it be expanded and what can be done in the future.
That's fantastic. Thank you. Yes, I know. Watching your presentation, it was very interesting to realize, some of the implications of water consumption and risk and what that looked like. And yeah, how to communicate that would be very challenging, right? You don't want to make people afraid, but you want to make them aware. And so that's a tough balance to find. I'd love to open it to the audience for questions now for the next, I don't know, 6-7 minutes or so. So if you have a question, if you can raise your hand or you can put it in the chat, that would be great. If it's to a specific person, also make sure to address that. And don't worry, I have more questions if you all don't have questions, so that's okay. Okay, I'll continue.
I
So
have
this
a
is one of my.
question, Kim. I have
Oh,
a question.
yes, please, Maya.
This is kind of came to me, and it's not directly related to your experience, but I would just really love to hear sort of what about like in your internship, what's next? What are you all thinking about your next step? Was that your question, Kim? That's my question.
It wasn't that. That's one of my follow-up questions, though. So good job. We'll jump right into that one. What's next for you guys, or what's the plan or the thoughts?
Well,
And
I've
if it's
been job
TBD, that's
searching.
okay.
I'll
Aaron?
go first. Yeah, so I mean I'm happy to be finally almost graduating here. Been a hard 5 semesters. But I have recently taken a position with the Arizona Veterans Research and Education Foundation. So that
Excellent.
is what I'm going to be doing next. It's up in Phoenix, but I'm going to be working with veterans and chronic diseases, specifically diabetes research. So
Excellent. Well, you'll be in
yeah,
my neck of
and
the
then
woods.
after
Come
that,
visit.
yeah,
I think Aaron might have
yeah.
froze.
So and then research, but yeah.
I think you froze on us for a second there, Aaron.
What's the last thing you heard?
I heard and then next.
And then next, oh, the suspense. Um, I think yeah, I think, I just want to work on my getting experience and eventually see what I want to do after that, if a PhD's next or something else. So we'll see.
That's great. That's great. Thank you. Precious, I saw you unmuted about the same time as Aaron. What's next for you?
Yeah, so I have one more semester to go, and I'm currently looking for PhD opportunities within infectious disease AP, um, and possibly any other research opportunities that could strengthen my research skills and contribute to the infectious disease AP world, and One Health. So particularly my interests are within zoonotic diseases, or diseases that can jump from animals to people, and I'm hoping to continue along that route. Yeah.
That's fantastic. Great. One more semester. You accelerated yourself. So you gave yourself a nice buffer. That's great. Grace, what about you?
I recently got promoted this summer to program coordinator at the PRC, so I'm looking forward to graduating in December and just chilling. And we recently just got a new R01 award, so I'll be joining that grant as a coordinator, and I'm looking forward to that 5-year cycle and doing that work throughout West Virginia with youth and substance use there.
Fantastic. The benefits of doing a workplace internship, right? So you can sort of continue and expand. That's wonderful. Kendra, what about you?
That is a good question. So I'm also graduating this semester. And currently, what I'm doing is I have a three-pronged approach. Nothing confirmed yet. However, my timeline is a little bit different. But I am applying for fellowships. I'm also applying for further programs, but more on the environmental side of things. At this time, climate and health is a little bit interesting, to put it diplomatically, at least nationally. So I've been looking at certain states who are still doing it. I will say for anyone who is interested, particularly within heat, Arizona is a great state to be looking at those kinds of positions. But I've mainly been looking at the east and west coasts and kind of seeing are there county level jobs that combine both climate and health in that. So.
Yes, also a tough time if your phrasing is climate, just like if it's equity. It's a tough space to be, but I'm glad to hear that you're finding some places that are still doing the work and looking for those. That's fantastic. Anyone else have a question? Okay, so I'm going to ask what I think is my favorite question that we have, which is what do you feel like you learned about yourself during this experience? That reflective question, right? I had to ask it. Aaron.
Yeah, so I was able to kind of reinforce my interests in working mental health, chronic health. But also, I think I've always been passionate about policy. I feel like that's something that is very important, obviously. Helps set up the interventions and the requirements to enforce, public health standards. So I think working to make a policy brief and kind of looking at policies um, was interesting, and it was something, that I'd be interested in the future. So I thought that was something that I liked or found out about myself.
Great. Yeah, I feel like APEs do and internships do one of two things, right? They can help confirm your path or they help you realize that that's not the thing you want to do. That was me during my APE years ago, right? So I think for you, it's great to see that it confirmed a path, but also kind of expanded a little bit and showed you that something was a little bit more interesting than maybe you had thought. And so that's great. Precious, could you share with us? What did you feel like you learned about yourself?
Yeah, it's quite a tough question, honestly, because it could go many directions. But anyway, one thing that I realized is that I didn't know I liked bats. So we so I'm from Malawi and we have bats, but they've not been associated with the rabies risk that we usually encounter. It's usually dogs from under vaccination of that population. But coming here and learning about how important bat ecology is to rabies, and listening in on calls of people who have potentially been exposed by bats was quite an interesting thing. I wish for once I was like, oh, if I could have a pet, a bat for a pet. But I mean, I don't think it's possible. But anyway, I think aside that is to say, I think to an extent it kind of reinforced my interest in zoonotic diseases. And giving me that expansion to say I think we've got this species that is very important. And as you might know, bats have been implicated in most, or many, I should say, not most, but many of these zoonotic diseases that have spilled over from their colonies to human beings. So having that experience over time, I think it has just kind of reinforced that willingness, or I should say, interest to continue in the route that I want to continue on. Yeah,
That's fantastic. I also think bats are adorable. I certainly don't want to be near them, but I do think they're very cute. So I can appreciate it. I don't know that I have a bat as a pet, but they're cute. Kendra, could you share with us?
Yes, I learned three main things about myself during that summer. One, I know more Spanish than I thought. It was they didn't know English. It was a situation where they're like binational researchers, but it was very interesting being immersed in that as well as the Mayan languages there. The second, I'm going to preface this, I love the folks and appreciate the folks who do laboratory work, but I realized that was not for me. As I appreciate them even more, I was in the lab on and off, and I said, this is not quite for me. But what I did get confirmed is that I still love community engagement, whatever form it is. I am a people person. I will definitely be working with people in the future. So those are the three things that I learned over my.
See, you had both. You had both arms of the APE, confirmation and don't like this one. So that's good. That's good that you at least had some confirmation. And your Spanish was, I think your Spanish was great. You had a great accent, and I thought, I mean, it was good. It was great. Grace.
I learned most adaptability because I don't think many people have their deliverables changed 3 to 4 months throughout their internship. So I think I just learned, the patience to, just adapt to an ever-changing climate. And, it was just what I could do that would still support the cause and sustainability of our group itself. And then what could also, you know, be a learning experience for me. So it was definitely, a big change that happened, midway through. But I think that I learned a lot throughout the process. So very grateful.
So follow-up question for you, Grace. Do you feel like you learned and were able to practice being adaptable, or do you feel like that's already a skill you really bring to the table?
I think it was just something in me that hadn't been challenged before. So that just kind of brought it out of me, of that just ability to adapt. And then just, it definitely speaks to having a supportive team around you too, to just be like, hey, this is going on right now. I know you're in it too. So what can we do to kind of resolve and fix this issue so that everybody kind of comes out on the winning end of things as much as possible?
Yeah, I love that, right? It was something that had to challenge and bring out in you. That's really great. Well, at this point, we have reached our time where we leave a few minutes at the end to go over a little bit about the conference details for folks to be able to participate fully. Thank you so much to each of you for sharing your experiences with us today. We're really appreciative of your time and your knowledge and your skills and the amazing work that you did out in the community. That's really impressive. And we're really excited to hear what you all do next. So what's next on the horizon for you? We love to connect with our alums, so we'll be excited to know what's next. And now I'm going to pass it to Vanessa. She's going to share a little bit of information about presentation viewing.
Thank you, Kim. We also want to encourage you to view the APE conference webpage to see this semester's MPH student presentations. They have all worked incredibly hard on their projects, and the virtual conference page showcases that. We will post this link in the chat here to the presentation viewing page. Presentations will be viewable in an on-demand format until December 7th. We encourage you to watch as many presentations as you can during the viewing period. For each presentation you watch, we ask that you fill out the presentation feedback form. It's going to be linked on the presentation viewing page. And now I'm going to hand it over to Danielle.
Thank you, Vanessa. So thank you everyone for attending today, and thanks to our presenters for this discussion. We would like to thank you all of our wonderful applied practice experience sites and preceptors with whom we work to improve public health. There's a link in the feedback form for this live chat here. We would appreciate if you could take a few minutes to complete that form to help us make the event better each time that we have this. So I'll put that in there right now. Thank you, Kim. And then we now come to the end of our live event. We sincerely appreciate you all joining us this afternoon, and thank you to our student panelists once again. And we hope you enjoy watching the student presentations and have a fantastic day.